A very warm welcome and good evening to all of you. Who it's very pleasurable and a pride moment for us today, as HORIBA Medical is conducting this webinar with CAHO committee, and HORIBA has been associated with CAHO organization since last 3 to 4 years for its quality-driven seminars and its presentations, its valuable inputs which are going across the healthcare segment and the societies, not only covering the laboratory aspects but also covering the hospital, the nursing, and day-to-day routine activities which has been carried out on the grounds of the quality. So a warm welcome again to all of you. As we all know, the pandemic continues to create a havoc with no treatment or the vaccines available. The only option that seems today to be effective during this challenging time is safety. Safety for everyone, safety for healthcare workers, safety for general population. As in the last webinar also, we had spoken about a lot in terms of sanitization procedures, which has to be taken care with our healthcare workers. As we have been nominated as Corona warriors in this current pandemic situations, the risk also lies so high till date. And now when we are understanding after this 5 lockdowns which has happened, we are unlocking every one of them. So with this, you would all agree on the part of the healthcare professionals are extremely important for us to understand the lab safety and the best practices to be followed by a laboratory personnel during the COVID time. Horiba at this juncture feels immensely proud to be associated and partnered with CAHO for this live and interactive webinar with the panel members available who will be speaking more on the lab safety practices which can be adapted, which are simple and which are easily approachable. In this event, we are going to cover the basic approaches and the needs and the desires of a lab safety. So as I was telling you and as has been already told, the COVID-19 pandemic has put laboratories on the edge even if they are not testing for the novel coronavirus. It's basically the laboratories who are testing it has to follow all the stringent rules and regulations which has been put up by WHO, CDC or national authorities. But COVID-19 has temporarily closed our labs so that it doesn't mean the science will stop somewhere. The science must go on, and for all of us to understand and know from all these live interactive sessions. So what are we going to discuss today? As I had mentioned already, there is an unlocking of the lockdown happening. There have been newer guidelines coming up from the Ministry of Health authorities saying there has to be unlocking in terms of a segment-wise position. And so the emergency or the essential services like our healthcare system are going to unlock. So our laboratories are also going to be unlocked from time to time. But what we have to know, there has to be lab safety and preparedness. What should I know when the lab is going to reopen following this COVID-19 shutdown? Or how do I live in a post-COVID era or in COVID era? What should be our diagnostic preparedness for the pandemics? If what type of testing I have to be doing in that particular containment zone or say red zone or in an area where I'm in a green zone? Are there new rules of safety coming up by World Health Organizations or Center for Disease Control? And what is this all buzz about PPE? Is it possible for every one of us to have a PPE? So the idea here would be we should know what exactly is possible for us. And we keep on saying the lab safety during a pandemic. The lab safety is always a top priority. But now as we all see, the rules are getting changed. Equipments might not be cleaned so often as the protocol demands in this current situation, as well as we may be lean enough in our earlier times of lab safety so that we have to keep on training and put our practices up to our employees. What guidelines to follow, as there are so many keep on coming on our WhatsApps and emails? Is there something called as my lab, my rule? The way I work in this laboratory or my laboratory, what type of rule should I follow? For all these questions today, I would like to call upon the eminent panelist members Dr. Aparna Jairam, who is a founder and director at Asavli, Dr. Aparna's Pathology Lab. She is also a CEO for Immunocare Labs, Cochin. Dr. J. Jayalakshmi, who is a professor, Department of Microbiology, PhD Institute of Medical Sciences and Research at Coimbatore. Dr. Seema Bhargav, she was supposed to be with us, but at the last moment, due to certain commitment and because of her health, she couldn't join with us. But yes, she had decidedly given her inputs on the same. So, without wasting much more of time, we should start our QA session or say panel discussion of the questions taking from all of you across the nation, the simpler one and the approachable one. So a warm welcome to both the panel members, Dr. Jay Lakshmi ma'am and Dr. Aparna ma'am. It is very delightful and pride to have you both to talk upon this particular subject. Dr. Jayalakshmi ma'am is a microbiologist who is also working in the molecular biology. Dr. Aparna ma'am is a pathologist and also an immunologist at her lab. So we will be having a mixture of questions which is going to be diversified to across the laboratory safety. Let it be microbiology, pathology, or biochemistry departments. So the first question, what I could see is more on infections. So this goes to Dr. Jayalakshmi ma'am. It is like, ma'am, can you please suggest on infectiveness of the various samples received and handled at the laboratory? Let it be a simple microbiological lab or a molecular lab. And there was one question in my mind every time seeking an answer. Okay, do we need to have a separate respiratory sample preparation areas or collection areas or storage areas? Ma'am, over to you.
Thanks, Dr. Prakash. Good evening, all. It's an absolute pleasure to be part of this webinar with all of you. First of all, I would like to thank Dr. Vijay sir and Dr. Lalu from CAHO and Dr. Aparna and Prakash for giving me this opportunity to share my thoughts and view with you all. Looking at what is infectious, any specimen that you would receive in a laboratory at any point of time for testing is considered potentially hazardous, right? So amongst that, which of them is infectious? This organism is pretty new. There is a lot of research. What we speak today may not be the final word. There may be newer developments coming. There are newer knowledge every day adding to whatever is known already. So with what is known and what has been documented, I would like to say a few things. The most commonly received sample, the urine and the blood, is the least infectious. However, the less often received sample, the sputum or the nasopharyngeal swab, the oropharyngeal swabs, and the other specimens is higher in its infectiousness in transferring. It could be as high as about 80 to 90%. In fact, the sputum samples and the stool samples, these viruses can be there for a longer period of time, and they may be associated with the infectivity of these patients as well. There are studies to say that it is just 1%. There are some documentation to say it's about 12% in the blood. But whatever samples that we receive in these from the labs, we have to be protected. So that's why we always say it is a standard precaution that is important. It does not matter what you are handling, but it is important that how you're going to handle and what is that you would require to protect yourself. So you need to do something where you would need to assess the risk. Any lab have to assess the risk in their local situation. They need to look at, in their own existing situation, what is the risk. Risk assessment is very important and it would require 5 steps. First of all, looking at the hazard identification itself. This hazard can be associated with the pathogen, organism by itself. It could be any organism. As of now, it's SARS-CoV-2 leading to a COVID infection. Or it could be a technique or a procedure, for example, a centrifugation, a vortexing that you would do, or a shake that is done, or slicing or mincing that you would do for a processing of a specimen. Or it could be the equipment itself that may be used in this particular situation. Or it could be the environment. Sometimes you need to work in a negative environment or a negative pressure environment, and therefore that would also influence the risk for a patient and its safety, or a person and its safety. And another would be the human factor itself. How well trained are our staff? How competent are they? Are they able to do by themselves? Are they being careless? Are they new? Did we train them enough? So there is a human factor. How many hours of work have we given to them? Are they tired? Are they being overworked? So these also would influence and add to the risk. So this would be looking at the hazard identification itself, and that's the first step. Second is evaluating the risk. So when you identify this is the risk, I need to know what is the magnitude of this. So I need to give a score to it. So then I can sequence it and say what is my priority in this. So I need to look at two parameters. One is what is the severity and what is the likelihood of its occurrence. So, less severe, more often occurring is also not good. A severe, in fact, severe risk that is less often occurring, which can be damaging, is also not very good. So you need to look at both aspects, the severity as well as the occurrence that it has. Then the third would be developing a risk control strategy based on what we have identified. You put a matrix and see whether they come into the low, middle, or the high risk category. And based on that, you structure and define a control measure within the facility for the laboratory, and you develop a risk control strategy. And once this is identified, you test it, and also you implement it at your laboratories to see whether this control measure that you have devised and you have put in place, would this work or not, or is there some mechanism that I can identify to see this is working. So I need to look at implementation as well as and to develop and also to implement. And finally, I also need to review it and see whether it is working. Okay, so I need to say, okay, whether the control measure that I did has made a change, and what was occurring more frequently earlier is occurring less frequently now. Therefore, the risk within the facility has reduced. So this is important in understanding the infectiousness, looking at the risk, and the standard precautions is a key. And the most important, everybody needs to understand good microbiological practices and procedures in the workplace, because this SARS-CoV-2 is pretty contagious, and it can cause serious infection to the laboratory staff if they are very, very careless. Thank you very much, Prakash.
Thank you, ma'am, for putting up in a very, very simpler way of like for evaluating the risks is very important. As we have been already been reading a lot about risk assessment, but I think because of this current pandemic situation, we think we are going into more details of it rather than what we may be just putting it across as a flowcharts and just going ahead. But I think somewhere the corona or the COVID infection has given us a more opportunity to learn about how we can assess the risk at each and every level. So I would like to have Dr. Aparna ma'am also, if she can add up to this question.
Prakash, I think I completely agree with what Dr. Jayalakshmi says, and also most important point is what you added is because of Corona. I think there are a lot of positive changes which have already happened, and we are yet. I mean, we'll also see in the coming time. But I would like to add my points in the in the coming
Right, ma'am.
questions. Yes,
So,
yes.
so
This,
following the same, I have a question for you.
yeah.
It is the same way. I mean, how it is like when we handle any sample, we every time say to our staff, "So handle it in this way. This is this department sample. This is that department sample." There are SOPs been made. So, what is
Yeah.
your take or comment on the sample handling in hematology and biochemistry department? Right from accessioning, right from taking it from the area where we have registered it and going into the processing. Why I am asking this question, because 70% of the laboratory across India would be standalone laboratory or might be doing some or the other and additional work. So it becomes very important for every lab to understand today, how do we take this situation, the pandemic situation of high contagiosity, along with our own safety, and also we process and we do the processing. And for me, even sample taking from one department to another is also a challenge now, right? So what's your take on this, ma'am?
I think the best one is people like who fall into the basket like where I am in, like standalone labs, smaller labs, and we are not into COVID testing, but we are exposed to it. And that's what
Right.
Dr. Jayalakshmi rightly explained, that every sample we'll have to look at it, as an infectious sample. And so right from sample handling, that means when the patient is coming into your OPD section, your small lab or a big lab or a hospital lab, how do you know? There is a scare, Prakash, that more than 80, 70, 80% of the employees are not able to join you. That's one thing. Second thing is that
Hello, Dr. Aparna. Hello. I think we lost your signal. Uh, Dr. Jayalakshmi, ma'am, are you there?
Yes.
Yeah, I think we had some issue with Dr. Aparna ma'am's connection. I think she will be rejoining again. So
Okay.
I think we can continue with that question, but probably she may add up to her bit in the coming time.
Yeah.
So do we think we can take up the next question which we have already gotten?
No,
Okay.
she was answering. Maybe I can
Yeah.
just try to address whatever in my little
Right.
knowledge of microbiology applying to the pathology and the biochemistry.
I
It's
yeah.
important. It's important to understand that
Yeah,
the
I
ocean
think she's
is
joined back.
active.
Yeah, she's joined back.
I'm sorry. So I think JJ, you can continue.
No, ma'am. We were. It was just like I was telling to add a point to on your aspect, but we were waiting for your comments.
Yeah,
It's
yeah. This
more important.
network is going to be more dangerous than corona. So we are giving the head gears so that the staff is protected. These two are the key areas where they have maximum threat or exposure, and definitely the PPE, which is a disposable one, or we are using something which is reusable one if we have autoclaves in place. That's where I think the first part which you asked me is the patient contact is handled. The second part is sample processing or transportation. I think, as Dr. Jayalakshmi said, it's a very very critical area pertaining to 15189, pertaining to infection. So everything will be transported as a smaller lab will have one processing room, a bigger lab will have sections like Dr. Prakash said. So they will be transported, taking all universal precautions and going to the respective desk like separation or how the lab is a small, medium, or a large lab. But I think the most important area where I see a bigger challenge today, when we are opening our labs, are patients who are coming to your lab for a malarial parasite test, Dr. Prakash, or
Yeah.
a dengue, okay, or a
Right.
dengue or a vidal,
Right.
and you as a lab owner or the process owner have to see, as Dr. Jayalakshmi said, whether your staff is tired, whether the staff is protected, whether you have dispensers for sanitization, whether your lab surfaces are cleaned regularly, who is monitoring it, because that is where we can control, or we will possibly have exploding numbers. I think that's where
Yeah.
the lockdown opening and this
Right.
particular webinar or many such will be helpful to people like us, Prakash.
So with the same thing, I had a question which I will taking from the audience itself. What is the risk in a hematology lab? Because aerosol is there as a query. I mean, how much percentage it is infective, or say direct contact is something which is very dangerous, right,
Yes,
from a droplet
yes.
infection. But in a hematology lab, do you think there is a problem because it is blood and blood transmission is not that much today?
Uh, there is, as Dr. Jayalakshmi said, or many of them are saying, enough data is not available, Prakash. So
Right.
labeling anything is not safe or safe. It's like we are shooting our arrows in the dark. So it's better to be consider everything under the same protocols. Yes, as we know, it's not yet proved Initially it was told that okay, you just wear mask N9 N95. Now we are coming to, you know how the criteria have changed with
Right,
time.
right. Yeah,
So
yeah.
I think it's better to consider every sample as potentially, infectious, for, let it be corona or non-corona. But now we have to change our lifestyles, our lab safety pertaining to these criteria, so that we are prepared and we are protected.
Right, ma'am. Thank you for that, highlighting the points. So, with this, I would like to go for the third questions, which we thought it is important to discuss. Uh, it's a scare wearing a PPE. I mean, we keep on getting a lot of videos. I mean, it takes 20 minutes to wear and then some more time to get rid of it, and a lot of sweatiness and everything. Yes, we can understand what happens in an ICU settings where the patients are actually very bad. They are open cases. And is it going to be like one PP, one patient when you are doing simple test to an advanced testing? So I would like to have a first take from Dr. Jayalakshmi ma'am, and then maybe Dr. Aparna ma'am can add to this. One PPE, one patient, or what is the correct protocol to be followed? And today only, I don't know. I mean, I am very active on this medical group in WhatsApp. AIMS have put the guidelines how to reuse your PPE kit. I don't know how do we reuse a PPE kit if it is a plastic made or any other thing made. But yes, it is coming up. So, what's your comment on this, ma'am?
Yeah, Dr. Prakash, it's like this. You have to look at the safety both for yourself and for the samples that you're processing,
Right,
right? In case you're handy, because earlier when we used to wear personal protectives, it is predominantly for the protection of the patients and others. Now it is for the personal safety predominant in this situation, right? So you are protecting yourself, and also you don't want to, transmit the infection. There is, you want to prevent cross infection, etc.
right,
It is not viable to get complete suit for everybody and then put them all into these suits which are very very uncomfortable to wear, and then each patient you change the entire suit. That is not going to be working, right? So
right,
we need to prioritize. We need to see what are the activities. Again, I go back to the thing that I said in the previous session, or the question that you asked me, that you need to have a risk assessment made. I still think that every lab should identify what are they doing, which zone are they, how many patients are they getting. If the numbers are very high, the likelihood of them coming up more to your facility is more, so your risk for infections within, for the healthcare worker, the lab staff, is much higher than in an area where you have numbers very less. So
right,
you can prioritize and use, you modify the mechanism that which you will use. Or for example, when you're collecting a sample, so you could use a kiosk which is working very well. You don't have to change between every patient. So you are inside, the one who's working outside only needs to change. But what is happening is that the one who's inside is wearing a full PPE, and the one outside who's exposed to the patient and the infection is wearing a very bare minimal PPE or bare minimal protection. So that is again a challenge which we need to address in a more systematic way and scientific way, I would say.
right.
Dr.
Yeah, Aparna ma'am, what is
Yeah,
your take
yeah.
on this?
Actually, Dr.
Because
Jay.
I have been there. There was a question coming up. What is the bare minimum PPE in a hematology or a biochemistry lab? Because again, it is a blood sample, and we still don't know what is the infectivity rate or the transmission rate happening. But yes, it is still a scare. So, what do you say about this?
See, I think let me start with, as this question was asked to me when we had an FNSC of one of the patient in the lockdown 2.0. Okay. And the patient was moving door to door. In fact, the story I put on my Insta, that the
Hmm.
patient had big lymph nodes here, Dr. Jayalakshmi, and he was not attended by anybody, saying that there is lockdown. And all I had to do is definitely come with the PPE and take his gene expert, which was positive MDR, and then we could start the patient on the treatment. I think that's when I had a talk with somebody for non-COVID labs, because everybody is talking about COVID, COVID, COVID. What about cardiac attack? What about diabetic complications? What about TB? So yes, as you said, Dr. Prakash, we have to prioritize our patients where we are coming in direct contact. For example, like USG guided biopsies, I do FNACs, or people who are doing such procedures where I'm coming with the contact of the patient, that too with fever. Definitely a full PPE is one patient, one PPE. That time you cannot, this is what I say, and I feel as it's your protection and the patient here.
Right. Right.
Number two is 100% again stressing the point where you have a kiosk, great. But what if a small lab like mine doesn't have a kiosk? Then what?
Right.
Then
Right.
I'm trying to save my exposure of my technicians. I put them on alternate shifts. Like, okay, I work with bare minimum people today, 4, tomorrow 4, so that
Right.
I save on my PPEs, but at the same time I give them PPEs.
Right.
And the people who are exposed, both the phlebotomists and receptionists, I'm trying to overlap their duties so that
Right.
they are protected. And a maximum rush is in the morning, say 9 to 12.
Yeah, there is
Okay.
one question which I need to take from the chat, which is a very interesting one. Two
Okay.
questions. One would be, I think, first would be for Dr. Jayalakshmi ma'am. Uh, do we have to use N95 mask every time? One. Second, or is it like only during respiratory patients or handling respiratory samples?
Okay.
Quick
Okay.
answer.
Yeah, is the quick answer, or should I explain and everything and tell you and then also answer you?
No problem, ma'am. You can
Yeah.
explain it.
Okay, because in infection prevention we call this as the hierarchy of control. Okay,
Right.
it's an inverted pyramid. So you have a huger thing, which is the first one, which is eliminating. If possible, eliminate. For example, if you as much as possible, if you can do away with the frozen, do away with the frozen. If you can handle otherwise, if there is a alternative available, do
Right.
away. Okay, so that is elimination. Second is you do something called a substitution. Okay, if you cannot do this, you do in a teaching institution like ours. So we earlier we used to put everybody into the microscope to expose them to specimen. Then now you can put them on the telemode, and then they can see and they can visualize and give their reports also. So you can digitalize your reports or your,
Right.
so you can modify a little bit. Then you add something. The next one would be an engineering control, where you modify it, give a negative pressure area if possible, put an exhaust so that it sucks out, reduces the load of organism. In routine in all labs, this ASHRAE guidelines gives you that you should have a negative pressure, better for laboratories also, as they would give for a hospital in any setting, as numbers would increase. Like not like what Dr. Aparna was telling, when the numbers are few. It's when numbers are more. At that time, when you have, particularly when I look at it in the microbiological lab scenario, where I'm worried. At that point, I would look at this and adding hand washing facilities into these areas. As an engineering control in those areas, definitely work. And administrative control, like what Dr. Aparna said, I would twin them together. I would reduce the load of people. I will not get all the 4 coming for a day and expose themselves to infection, so that they also don't use most of PPE. So I minimize the people and put them together in combination so that I reduce. But if you would look at this interesting hierarchy of control, the least is the PPE. The
Okay.
bottom tip, the smallest is your PPE. So you have to look at elimination, substitution, engineering, administrative, and the last one would be your PPE itself. So that's the last, but everything else should be there. But in the PPE, you
Yeah.
have lot of things. I'm sure everybody knows. Even the kids
Right.
nowadays know
Right.
all the components. But
Exactly.
for N95 in a lab, okay, we do have some aerosol generating procedures in our laboratories as well. When you're centrifuging, when you're vortexing, when you're having a agitating procedure which is in a lab, it may be a research or otherwise a diagnostic lab. You're doing this, and then you are a molecular lab. Then you are supposed to collect it like wearing an N95. Then when you're doing an extraction of your RNA, you need to wear an N95. Also, what Dr. Aparna was telling for an FNAC. So you do not know what the patient has come for, and he may be sick, and he may be coughing
Exactly.
in your face when she said the lesion is here, and I'm trying to see. And the patient, you cannot put a mask and everything and then cover that area for you to take also. And he or she would cough straight on your face, and you're such a close distance. Here, you definitely require an N95 as well. So there are identified areas in the lab which you need to wear an N95, And when you wear an N95, I'm telling you, it's very difficult to breathe. So you need to know how you should wear an N95 also.
Exactly, exactly.
If there is a set of PPE that you have, like, from top to bottom, you have plenty. But all
Right,
of these have to be worn in a particular sequence. Only then it works. And it has to be removed in a particular sequence. Only then it is useful and you prevent contamination. You are not supposed to make agitative movements. You cannot shift quick, etc. You need to wash hands between each of your steps that you're doing. You wear a double glove if required for a procedure. All of these. If you're wearing a full PPE, and if somebody is wearing a full PPE, they will not be able to breathe well, speak well, and there's a sweating. All of these would be the difficulties on a person that is wearing all of these. But if you can use an N95, they could use for a 6 hour stretch only.
right,
And if they're going to wear an extended, maybe a little longer on the same activity, same person, then they can. And it is preferable to wear a face shield over your N95 so that there is a splash hits on the face shield, not on the N95. And you will see a lot of people wearing a mask, a triple layered mask, and then wearing an N95. That's not the right thing to do at all. You need
right.
N95 and then wear a triple layer mask if you need to. Okay, but covering with a face shield is the best thing to do, because any spray and splash would come on that. You can decontaminate and reuse if it's reusable, or if it's a single use, you could discard it. And then there are a lot of alternatives. Now people have
Right.
innovative methods of doing, and they could do away with this. And very, very important, if they're wearing an N95, there are certain techniques that they need to follow. They need to bend down, hold it like a cup, put it on their face, and take the lower string towards behind and back, and then take the upper string over their ears. They cannot just take it together. I have seen people taking it and pulling it down into their face, which is not the
Okay.
right thing to do. And you have to press it and hold that it fits on the face like a cup completely. And they should do a fit test, which means they need to find it difficult to breathe in through the mask itself. So that is important. And somebody has a beard, they
Yeah, I
cannot,
know. It is more difficult.
they are
Right,
not supposed, they cannot have a proper fit as well. So ideally, if they are working in a lab where they need to be wearing it N95 more often, prefer that they shave. Okay, and after they remove, they have to wash hands. And wash
right.
hands is an important thing. We should be trained to don and doff. Okay, donning means wearing, doffing,
Downing, yeah,
and
exactly.
doffing is more crucial than donning itself, because now you are contaminated your material all. So you have to be very careful in removing them carefully so that you dispose in appropriate biomedical waste bins. So you have to be training your staff adequately well before even you put them in place on using this, because giving the best material and not use and not know for them not knowing how to use it is a total waste of the material also, and definitely they're going to get.
Right.
And if they
Yeah.
need to use it for a longer time, they can keep. So you were mentioning about this
Right.
science protocol. They have defined this protocol, and it is also there in the CDC that they can use it for 5 days, right?
Right.
You allow it to dry in between. So at least it takes about 72 hours minimum for it to be, drying the secretion. So you put them in a breathable paper bag and allow it to be there. So you give somebody a set of masks and label them and with their names and their ID numbers, put them in covers and give it to them. So they will use it on one day, and then you will label it as day 1, 2, 3, 4, 5, and then on the fifth day they will start the first one. So they will start to use like that for 5 times, and once that is done, they can discard all of them together and get a new batch. So this way they can use for an extended period of time, and it is for a single person. They cannot exchange between people, and they should be using a face shield or something too, so that it is not contaminated outside. They should be careful not to touch the mask from outside. So these are all some very, very important things that they should
I
follow.
know. I mean, you had
Yes.
actually highlighted a lot because there used to. I believe I will be calling you back after some days to only talk on how to use a face mask, because that is. I think it all started as a general mass motto of like wear mask to be safe. So, ma'am, Aparna, ma'am, do you think in a normal laboratory, probably using a normal, because there are question, you can we use a cloth mask? So I think, do you put this as a point or a comment on this? Okay, using a cloth mask and a face shield will be helpful in a routine processes, or will
Uh,
there be any different thing?
I think if you have a face shield which is reusable, now our IMA is providing us with a thing and a reusable face shield, and then having a it depends. I mean, whatever Dr. JJ said, I'm able to do that in one of my big setups where I'm glad that I'm following this. We are marking on the N95 that 1 day, 5 day, and then discarding it. But if it is not possible, like I have a small lab where I have only 5 patients coming in, then I'm able to give N95 and the face shield for the front desk, and internally I'm using a cloth mask with the face shield. That's how
Right,
we have to optimize
right.
it. Yeah.
So
No,
there are so many questions on this mask. I think we will take it at the later on.
can I?
Yeah, yes, ma'am, you can add it. No
So
problem.
for the cloth mask, I would again say here again your risk assessment would help. So if you are working in an area where you are not exposed to these infectious material that we were discussing earlier, then in that case, definitely you can use them. Okay, you could use much more boldly than the other areas where you cannot even use them because
Yeah.
it does
Yeah,
not
that's
it does not filter out your bacteria or the viruses effectively. So you
Right,
cannot using routinely in an area where you are encountering infectious material in large amounts. But
yeah.
within the lab, wherever, so you are again, that's what I said. When you do a risk assessment, you know where to
right.
prioritize, you know where to put your material also.
Exactly. So with this, I think we there are many questions on this, particularly on the mask, as I was telling. But we'll keep on moving, and if time permits, we'll discuss
One
more on
request,
this.
let them not wear it on the neck.
Okay.
Yeah.
Yeah.
Not like a necklace.
Right. But they should not start even wearing on the head also. Then it could be another challenge to us. So with this, I move on to the question number 4 of the discussion question, which is basically pointed towards Dr. Aparna ma'am. So what's your suggestion on equipment sanitization? Because this word sanitization has been quoted after the mask came into picture. Keep yourself safe. I mean, it is what I can say. It is social distancing, mask, and sanitization. It is SMS, which is what I think it has been followed everywhere, and it has been much more. I mean, put as a point. Okay, follow this. So on sanitization, we all know we can have a self sanitization by using sanitizers and everything. It is on your hands and wherever possible, use a simple PPE equipments. But what about the equipments, which is very important? So what's your comment on this? And also the protocol of centrifugation while decapping of the tubes and all.
Yeah, I think very, very important, Prakash, that we are. I think when we were handling this, I remember the journey. One point, what do you call the first phase of lockdown, we were all panicked and we all went ahead and we didn't get even N95. I remember then. Then we started talking about the complete PPE with COVID patients. Now we are talking, I'm glad about PPE and general lab. What about the equipments? I have seen some of the hospitals, I'm talking about smaller hospitals where some ward boy comes and he's like, nahi, nahi, I have to sanitize everything. And he is just pouring some phenyl, some disinfectant solution so that it is smelling like a typical phenyl solution, and he's cleaning every damn thing, saying that, okay, this is sanitized. So, the last question, which was there always in the mind, is we are touching our equipments. Let it be a centrifuge, let it be a phone, for example, a keyboard, a mouse, or a biochemistry analyzer or a CBC machine. How do we touch base upon that? Because as we spoke about the reception and the blood collection, this becomes a second source where you will be touching these points, these keyboards, these mouse, telephones, and the tabletop surfaces. So what about them? I think there are protocols. Which one is the best one? There are alcohol based. There is something which I happen to read, which are just fancy. I call them as boutique sanitizers. There is no scientific background to it, and there is scientific background to it. So we really have to choose the right sanitizer for our equipments and the lab surfaces. The most important point, Prakash, which I saw practically was, it was used, a proper sanitizer solution was used by one of the decent labs where I had gone during this COVID times, and immediately the technician was on the place to work. Now, is that effective? It is. I mean, the it has to dry, then only it will be effective. The space is all wet, and the guy comes and cleans it with the tissue paper and starts working.
Right,
I
right,
mean, how does that? It is just your mental satisfaction that, okay, as Dr. JJ said, you're giving PPE, but if they don't know they're putting the N95 here or here, what's the use of spending your money? And
right,
so I think sanitization, a word looks very fancy and beautiful, but it has to be followed. First of all, choosing the right sanitizer, choosing the right person who is trained, and training the other people how to behave when the sanitization is done. I think these
right.
are three things which we should have a separate webinar, like you said, only on equipment sanitization. And
Right. With the same thing, there was a question following this, so that I will not break it up between both of you.
no, but
So,
I think Prakash, let JJ add, Dr. Jayalakshmi
right,
add on sanitization, because that's how she's. Yeah, please, JJ, go ahead.
Yeah. No, I really like what you said, because that is a concern, because you need to give the contact time, which is important. Actually, if you would look at, there is the Environment Protection Agency (EPA) on, I think it's on the 20th or 21st of May. They've given a list of disinfectants which can be used, which are
Yes.
effective against. But this is a very simple envelope virus which can get killed easily. All right. So you don't need rocket science. You don't need a huge, big molecule to break this small stuff. Right. So, but there are some good material which are recommended for its use. Some of them, the manufacturers say how to use it, and which may
Yeah.
be used. See, what is happening is people have now moved from, because a lot of guidelines, the guidelines are standardized so that everybody can afford it, everybody can buy it. So guidelines would clearly say use sodium hypochlorite or an alcohol or a phenol or quaternary ammonium compound. Okay, so these are easily available, so nobody would find it difficult. So people have switched from whatever they were using to these things. Okay, that is really not required. Okay, whatever they were using, if it is effective enough, they can continue to use. And if they need to understand that, what works well, and it so much depends on what is the surface, what type of surface it is, what type of a material that is made of, what is the compatibility that it has, what concentrations are they using. They can use the best of the disinfectant. Again, like the mask, if they use it in the lowest of concentration, it's not going to work at all. And it is not equally good if people spray 1% sodium hypochlorite over everybody into those tunnels. That's not recommended also. So they need to have an ideal identified percentages of disinfectant solution sprayed on those materials which they are compatible with, in a concentration that is appropriate, and also give that contact time. Contact time is the key. So minimum of 10 minutes at least they should give for, they say, some of them work with 1 minute, etc. But minimum of 10 minutes would be the best for most of these disinfectants to have an action. I really could relate to what you say. They clean immediately, they start to work, and it doesn't work that way at all. So it is very, very important that they identify. And not every disinfectant is all good. They are not going to be very, even the sodium hypochlorite what we are using, continuously you use on chemical metals, you in over a period of time you will see them all corrode. Okay, it is not going. So they need to know, if they are using sodium hypochlorite, there are some rules to it. So they
right,
cannot on the organic material. Okay, they need to clean first and then use it. And after they use it, they have to wash it with water, or clean it with clean distilled water or clean water, depending on the area or surface, and then clean it with alcohol. So this
right.
entire process, if they do, it works on a metal. Otherwise, they should just leave the metals free without these sodium hypochlorite and use whatever they are compatible with. So the
So,
alcohols or anything they could be used. Yeah.
ma'am, I remember when I joined as a laboratory resident and everything. So we used to use sterilium most of the time, applying everywhere. I mean, sometime on the sides of the microscope also, so that we used to feel that we are all away from the infection. So don't you think this practice? That is why I had a question. My lab, my rule. I'll use all and none phenomena or thumb rules. Like I have one sanitizer, I will use it for my people and for my equipments also. Is it going to work in that way? Because there is so much of stretch happening only on sanitization. There is no other thing which is coming into picture. Protect yourself, protect your environment. So there has to what do you say, I mean, on this recommendations, Aparna ma'am, what is your take? Because standalone laboratories, I mean, I had worked in both the sites, so I'm just giving my personal experience on this. So if one sanitization or one sanitizer is available, it will be used for everything. This is what I think. So what do you suggest on this?
See, I think Dr. Jayalakshmi has very nicely scientifically explained. I will
Right,
give you
right,
examples that you have to use the right kind of sanitizer for the right kind of. It's like if you're having an idli, you will have it with chutney. You'll not have it with pizza, right? That's how it is. And I'm giving you practical solution that uh, again on sanitizer. I'm the only lab in one of the smaller cities working, Prakash and Dr. Jayalakshmi. I have got sanitizer, sterilium, sodium hypochlorite for my equipment and lab surfaces. One of my staff is sanitizing every 2 minutes. Every 2 minutes she does like this. Ho gaya. Every 2 minutes. I said that's not going to actually work. Your hands are going to be. There was enough of thing that pura dry ho gaya because this alcohol based sterilium. She is using the sterilium even on the toilet door, on the microscope knob, on the slide box. Is that what is going to work? So I think, I mean, my friend has explained rightly. And again, we have to use anyone, whichever we are using, in the right concentration for the right amount of time. I have seen that people are using it. Yes, they are using it or maybe overusing it, but not following the time. I think that's what I have seen in the last 60 days. They are just using it and wiping it and starting their work. I don't think that's the way it will really work.
So we
Yeah.
JJ,
need to have two sanitizers. That means, I mean, a personal way and a professional or the processing sanitizers, like for our equipments. Because in laboratory, the only other person what we see is a machine, and they are the only one who are there with us throughout the day, right?
yes,
Day in, day out. So
Actually,
we
if
need to
you
have two different things, right?
absolutely.
Actually, if you look at the usage of these alcohol and sodium hypochlorite, without our knowledge, we are increasing so much more than that is required. And also the amount of waste that is generated out of these personal protectors, which are not really required and people are wearing, all of that is also adding more load to it. And people are washing hands. Earlier, when we used to conduct this sessions for hand washing to make people wash hands, it used to be such a pain. It should be so difficult to make people wash hands, and the complaints would be so still poor. I'll be working my head off and saying, I did so many innovative things. I did this, that, that. By the rates are not increasing. But now I don't have to look for. I am sure it is 90 plus on the hand hygiene complaints because everybody is washing hands so much
Right,
that all our tanks are down and our
right. Even the water is going every day. That's what I can think.
But
Uh,
what Dr.
yeah,
Aparna said, this sanitizing the microscope knobs and that can be done on specified times of the day. Okay, so that it gets sanitized and clean, not with every time. If it is not a procedure that is contagious, whatever they are handling,
right,
they're
right.
using the formalin fixed smear and they're sanitizing the knobs every time.
Exactly.
No,
That is also true.
yeah, so they
Right,
have to look at, but it is recommended that for a sample that is brought in a carrier container or a box, that you have to sanitize or on the surface. In fact, you're not supposed to spray, you have to supposed to clean it. Spraying
right,
is also not recommended because it sprays out the organisms out there. So you have to
right.
clean them and then you have to take it into your lab and open it under your biosafety cabinet. So those are
So,
all.
but yeah, I mean, this is what I mean, the basics are important to know, and exact science behind this. Why do we use it and what we have to use is very important.
Logic.
Following this, there are so many questions for which I can see on the chat box. Basically, where do I store? How do I discard? So, yes, we do have this question for Dr. Jayalakshmi ma'am, because uh, the safe disposable or the biomedical waste management in a lab, which is a very important and broader question, very lightly taken at many of the setups. But it is very important now because I may have a person coming in, I don't know, infected, not infected with COVID or non-COVID, but yes, infection is there. But I think this is also one of a very important part and parcel of the lab which has to follow with the rules. And secondly, the environmental safety. There was a question also like, do air conditioning increases the risk of infection within an environmental area where you are having a patient or doing a procedure? So your
Yeah.
comments, ma'am, on this.
Yes. Okay. One is the safe disposal of biomedical waste. You will just have to follow 2016 rule, okay, Biomedical Waste 2016 rule with the amended 2018 and 2019 guidelines, okay, as applicable as it existed in the past. It still continues to be the same for the laboratories. There is no change in that, okay. So what has been added to it is specific to the COVID samples that are received. Okay, how do you know this is COVID and non-COVID? You cannot differentiate. All right, but you will, like I told you, you are going to consider all of them infectious only. You cannot label every waste that is coming out of your lab as COVID waste, COVID waste. Okay, because the process is going to be very different if you're identifying it as a COVID-19 waste. Okay, so this is identified. This kind of terminology, specification, and focused collection of waste is in the sample collection area. Okay, if you're doing a COVID testing, and in the COVID testing area where your extraction room, whatever you're doing and whatever is coming out of that waste, so these are the areas where you will have to put it in a laboratory as COVID waste, COVID-19 waste. Okay, if you are having a lot of samples coming out from your different areas, you're still going to be decontaminating, you're still going to be putting in the same way, and so therefore there is not much of a difference, right? So now, when for these COVID specific waste that you have, you need to put them in double bags. If you are putting in a yellow bag, to double yellow bag. If it's a red bag, it's a double red bag. Okay, and then you have to label on top of it as COVID-19 waste. Okay, and the container on which this is going to hold has to be sanitized with a sodium hypochlorite. If it is not a metal, then you have to clean it again with water. All of that is need to be done. Okay, then you have to tie a string to it, and before you hand over to a person, you also surface disinfect it with sodium hypochlorite. This is as per the government requirements and the regulation. So this has to be documented. In fact, you have to write down in a register saying there's this much of COVID waste generated. The route at which is taken out, it should be known. It has to be covered. The person who's taking should be trained, and exclusively on a particular time of the day they have to take it. The weight of the waste is also be documented. The person who's taking from your facility should know that what you have collected is a COVID-19 waste. Okay, so this has to be there. For a hospital setting, it becomes easier because they may be having a ward where they have a patient isolated with COVID, and therefore in a lab setting, which is a standalone lab where you would get a lot of patients, and if you're not an authorized COVID testing lab, I don't think you will be able to do this activity, because then everybody will be putting their labels on everywhere. So that is not the reason, that's not the logic behind this. This is to focused disposal of waste generated in COVID intensified activity or high intensified activity of COVID activity. Those areas alone you will have to have this particular way of disposal, and still you will have to segregate your plastic separately, your needle separately, and your glassware separately in different colors. Your PPE would go into your yellow, your gloves would go into your red, and your tubes also will go into your red, and your needles will go into your punch-proof container, and your glasswares will go into your blue. Now, suppose you are doing a molecular test. Okay, then you are generating waste, which are those minuscule tubes and nucleic acid. All of these, remember, they need to be all of these, just like your vacuum that you are generating from the routine labs, and the microbiology waste that you are generating in your routine microbiology lab. These wastes need to be autoclaved before they are disposed. So there are two ways. They call that as the wet and the dry. When they have the material with the solutions left over, you call it the wet waste, and the dry waste is just the tubes along there. The wet waste can be put in 5% sodium hypochlorite solution as per the CPs, the Central Pollution Control Board recommendation as given in the April 18th, 2020 guidelines. So you could dispose that way, or you will have to autoclave them, and that's the safest to do. And every time you autoclave, put a sticker, which is a chemical indicator, and once a week you have to put a biological indicator. These are definitive requirements for handling the COVID waste. Now, what about the environment? So how do you want, like there was a question asking, should we have
It was the question. Yeah, air conditioning. Does air conditioning increases the risk of transmission? If many of the laboratories do have air conditions, we all know.
Yes.
Yeah.
I have looked at what is called as ASHRA guidelines. The ASHRA guidelines is the American guidelines for these environment. And they have come up with guidelines for hospitals as well as the laboratories also. And they say you need to have air conditioning. Okay. So what happens when there is an air conditioning? Definitely, you cannot have a good negative pressure. So you need to increase the load of your AC so that it still maintains the temperature within your system, because your machines are all are working at a temperature of 22 to 24. We at Coimbatore will have 37 degrees centigrade, and somebody else may have 40 and 45 also. So we need to be having that particular temperature maintained, and we could have those exhaust devices, but for all of these you should increase your strength of your AC. Okay, so you could have your AC, but if you have your other engineering controls in place. In fact, the ASHRA guidelines also say that you need to have your air exchanges handled, where you have, like any other facility, you will have 4 to 6 air exchanges happening, in which you have two exchanges of fresh air coming in the last 1 hour. So
Right.
this is a recommendation by the ASHRA.
Okay. Aparna ma'am, what about you? I mean, I specifically asked this because the standalone laboratories, I mean, we are very much, whenever a machine is there, so we try to give a lot of air conditioning to the machines. And we think the machines may get overheated and the results may go haywire, and the recommendations which are usually there on the laboratory aspect. So, do you think putting on the ACs would increase the risk of transmission now? Because the air is not circulating, as ma'am has highlighted very well. I mean, how we can utilize according to the ASHR guidelines. But then
See,
also,
as I mean, this is fantastic, and I wish all this is possible in most of our. That's why I think it's a very good combination, Prakash, that you have chosen one from a very very small, setup where we can look at something where ideally, Dr. Jayalakshmi, these small labs have one small processing equipment zone where an window AC is fit. Mostly, I'll tell you about 65 to 70% of setups will have something like this, and the reception and all is just air cooled. Okay, so what I have been practicing, though there is no data, but what we can do is, most of the times when the equipment's Prakash, if our CBC analyzer, which I
right,
have, if I don't on my AC, it starts giving an alert that the
right,
temperature is high. And Bombay, Dr. Jayalakshmi, is at 38 with high humidity. So what do we do? So what I do is, yes, during the processing, definitely the AC has to be, otherwise you are just not able to function for two reasons. One is your staff is in some minimum PPE and your equipments are heated up. Now, and once the processing is done, because sample loads are lesser, we open our windows and we see to it that, okay, I may not have a duct to get in fresh air, but I have window to get in the fresh air. So again, risk optimization is what I think both of us are talking. What she has said, wonderful. I also happen to read it thanks to CAHO, that we read this,
right,
but it's not practically possible in most of the part of our country.
You
So
can
I,
have your, yeah, you can have your windows open,
yes, yes,
right,
definitely,
right,
yes.
and have an exhaust. But when you have to maintain a temperature within, that is how your equipments work. There may be
Absolutely.
there may be an area where your equipments don't need that particular temperature, and you are just sitting there and working. Those areas may not require this kind of specifications as such. But for
right.
those which you require, your priority becomes your sampling, and there you need to add up a little bit, work a little more in increasing its efficiency of working in a system where this air conditions work.
So Dr. Prakash and Dr. Jayalakshmi, I think one of the practical examples I'll share, that we have a hospital-based setup in a small suburb called Malad, and my AC, adding up the AC becomes a challenge because engineers are not coming in. So what we did is, okay. Again, I think we are just sharing our experiences so that the attendees gets benefited. Instead of two people inside the processing room, we have said, okay, 12 to 2 will process CBCs and biochemistries, reduce the time of the person contact with the machine so that the heat generated is in control, because no engineers are coming
Right.
in place. Now I think from today we'll see some people coming and servicing our ACs. So I think these are things which we have done out of experience and saw and able to function for the last 60 days.
Right.
So
So,
yes,
ma'am, I think with this we could understand what exactly has to be taken into consideration when we are working in a closed environment or a bigger environment or many people around and the machines. There might be areas like in phlebotomy there is no machine but people are there. In
Yeah,
processing there are machines but there are no people, but yes, at the same time the balancing is still happening. So with this
absolutely.
I think a very important question coming is and I think which will be a most important document also seen by the NABL, NABH, CAP, any accreditation committee. Okay, what are your training requirements? How frequently you do it, and what you need to add upon with this pandemic situation? In some way, it is a boon for the medical fraternity. We are going to learn many things about the self safety measures and the safety for the other patients, so that we maintain a good avoiding the risk transmission. So what do you think, what would be the safety requirements? It is for both of you, I mean.
Yeah, JJ, take
Okay.
it.
All right. First of all, we need to train them well. Yeah. So even before we start, and we have them some defined, simplified, whatever works in our place. Again, I go back. I really love this risk assessment. You have done in a simplest way possible. This is all I can do. This is what I am able to do, and this is my setting. In your own settings, if you would find, you will define some things and you write down, and that you will start to teach your people so that they perform. And you have to evaluate whether they are doing very well also. So should be something called as monitoring. So you train them, you monitor them, okay, and then give them a feedback saying that, see, you have to work a little bit better, you do this, because safety is a key concern at any point of time. You will see people wearing these full PPEs working around the entire lab. In fact, there are some unidirectional flow that they have to maintain in the molecular lab that they need to know, understand why they are doing. So sometimes they do that because they want to save the PPE. So if I wear it, I can wear for 6 hours. Okay, why should I wear it for just extraction and throw it away? So they will wear it for long hours and then go between room to room and then contaminate everything. So
Absolutely.
we have to teach and train them everything. So what is this infection? So some in simple ways, not just the infection, in every other practice that they need to understand in the processing itself. For if they are going to use an PPE for over a period of time, you should tell them how they should use it, where
Right,
they should leave it, okay, and then how should they wear it. And somebody has to supervise them and see whether they are doing it all fine. They should not be wearing gloves and walk around the place and touch everything. So they have to be trained and taught on all of these, and during that period they should be asked whether they are doing well. And then also that monitoring has to be given as a feedback for them so that they
right,
improve. And this has to be over a period of time, like they should define some,
yes.
that should have a schedule, and then they should train all of them so that there is no way that not anybody is missed, the days and the
So
night
yeah,
duties, whichever schedule they are in working.
anyways, we are sticking to the timeline, and it is interesting to see people are still loving this conversation happening. So we'd like to take upon certain very interesting question for both of you. So these questions are coming from the audiences who have joined for this session. So there was very interesting question: what would be the new norm in dressing of the laboratory technician? Will you allow the jewelry to be there, or you need the hair to be tied, or you need to come in a partial PPE kit or something like that? That was the first question. The new norm of the dressing guidelines for a technician or a laboratory personnel when you enter into a lab. So what do you say about this? Do we need to change?
Yeah, I think the most important what we I think 15189 itself says that without COVID also, in the processing area, it said that you will be tying your hair with a head cap, with a, you get
Right,
the disposable cap, or if you cannot afford, you can have an cloth cap. Definitely, mask was compulsory even then. I don't think we were following it, Prakash.
right. I
Okay.
mean, that is what I'm telling. It is a
Yeah,
boon to
yeah.
have COVID in this time.
And if you remember, Dr. Jayalakshmi, I think when we attended our assessor's course, it was always told no jewelry. Or there was a changing room. Why the changing room is kept? It is kept so that you tie your hair, you remove your earrings, your all the jewelries, you come inside the processing room in an apron instead of a gown, definitely. Okay, but the head cap and the mask was compulsory even then in a routine non-COVID lab or a non-molecular lab. In a molecular lab, you will come with proper guidelines, as Madam was saying. Without COVID, also we were doing HBV, HCV, gene experts, and wearing a shoe cover,
Right.
isn't it?
More
And
infectious materials, I guess.
exactly. So,
Yeah.
so nothing changes. We just have to follow to what was told to us before, and
Right.
just stick to that. That's what I think.
Ma'am, Jayalakshmi ma'am, very interesting question to you. I have done the process and everything. I had gone to a lab. Now it is my home going. Okay. What protocol should I follow when I reach home?
Very important. Yes.
So, okay, it depends on what you did. What was your processing that you did? Whatever you did, you will wash your hands first. Okay, you have doffed yourself, whatever what PPE you were wearing, and dispose it appropriately in or store it as you were advised to, and then wash hands. And if you had a changing area, if you are in a lab where you had a dedicated changing area, what Dr. Aparna was mentioning, you would change and you will have to leave. So there is nothing, there is no big anything that you do that you when you go home. But there are some good practices that they mention that if you're wearing a PPE for long hours, that is not done routinely in the laboratory. It is more in a COVID ward that they are in long hours of
Right.
PPEs full dawn. For them, they always say you could use some, beat it in gargles, okay, which may be useful. Use, take a little bit more vitamin C or B, so that it improves your immunity. These are for routine, you routine. And this is also useful when they accidentally come in contact of material in the mucous membrane, in the eyes, so they can wash. So those are all with the iodophores they could use. Okay, in surfaces on the skin they could use alcohol to clean them, but otherwise there is nothing like specific from a laboratory. Just because you processed, you have to do something new today because you've been doing all that so long.
So,
And if you're very
yeah,
if
I
you're
have a
very
question. I have a question from my side now.
okay.
I mean, I consider like Dr. Aparna ma'am as a non-COVID facility and yours as a COVID facility.
Yes,
So
we are.
if I have to ask a question on this, as a non-COVID facility, I'm working at Dr. Aparna's laboratory and I want to go home. Do I need to quarantine? Yes or no? And if I'm working with Dr. Jayalakshmi ma'am's laboratory with the COVID facility and running the test, do I need to quarantine? And if so, how long? Aparna ma'am, first you.
Why would you quarantine somebody for 14 days? I don't have any staff working the next day. Then.
Okay, I think Prakash, this is practically something which I have faced, so I will answer it first. I will just like to add one more point. What I have been doing is, Dr. Jayalakshmi, and the audience who is there, most infection, apart from washing hands, I think the most brutally used thing is I realize mobile and car keys. Okay, I have seen that you place it anywhere. There is no PPE for mobile. So what I'm doing is the moment I'm under my building in my parking garage, I clean my mobile because there's a sanitizer in my car as well, and I keep my car keys in one dabba, like a visit box, and they are just near my shoe rack. That's the change which I have implemented for me and my family. Just adding to the previous question, and now quarantining Prakash. Yes, if Prakash is working in my lab, non-COVID, which I had one of the episode where we had one patient coming in for an emergency surgery of cholecystectomy. I don't know why was he waiting for such a long time, and he came in now, and it's a hospital-based setup. So the COVID test was negative day one. He was operated, and then day four, COVID was positive. The person who got in connection with the patient was my technician. Okay, so I had to send him, and because we are working on a very bare minimum staff, nobody interacted with that staff, including me. So I had to quarantine him because there was a proof. Okay, he's still on quarantine. But a person like me who did FNSEs day in and day out with a fever patient, but I don't know whether the result is COVID positive or negative. I'm following what Dr. Jayalakshmi said. I'm following all the hygienic practices. I come home, I rush to my bathroom, I take a head bath, I wash my clothes into hot water, and come out and try to maintain the minimum distance with my family because I cannot quarantine myself, and I do not have a proof that my FNSC patient was a COVID positive patient. I think I have answered your
Yeah.
question.
Yes, ma'am. Yes, ma'am. Surely. Ma'am, Jayalakshmi ma'am, what about you? If I'm there with you and we do a lot of COVID positive sample, will you allow me grant me a leave or quarantine me for some time? Because see, this is the practical question what we also get
Yeah,
from the
see,
lab technicians. Okay, allow, I will not go home. Allow me to go this side. I will not
No,
meet
no,
my
no, I will not
family.
allow. You are using PPE kit. Why should I?
Yeah,
no, no, no.
this is
The thing
scare.
here we are in the COVID lab. The purpose of that lab itself is to diagnose, and therefore there
Yes.
will be positives too. All right. There are suspected samples coming in there, so they are more extra cautious. Studies have shown many times and more, whatever little we have already, people working in COVID facilities are not becoming positive compared to those working in the non-COVID. So I'm worried about Aparna's lab than my lab
Right, right,
because
Exactly.
we are very careful in every aspect. We look at the engineering controls. We look at whether they are done properly. There is somebody supervising. There is somebody checking on. So they're very careful, and they also don't want to be. So they're very careful. In fact, I tell my technicians when they come in first days, they came just like that, and I said you wear dresses which are closer to you because in Coimbatore we usually wear a sari or a salwar rather than a pant and shirt. So I said you choose to wear. So my the staff who works and cleans up the housekeeping staff also, she got a salwar stitch because I told her because it sticks to themselves. It doesn't float out every other way. And then I said, minimal jewelry, whatever you have, please don't wear anything else. Tie your hair up, okay? And so they are following to a T because they're very scared and they wash hands more frequently. Their doorknobs are cleaned very well. They have a schedule for cleaning their telephones which are inside. The monitors are clean. The everything is clean. They have a schedule for cleaning. It's high end that's happening continuously. That is there because any patient, for example, that's coming here, which is asked for a COVID test, may come positive. So they are very careful.
right, right.
Told them. So then what they do is these people who are working in these COVID laboratories, they have a wash before they leave. Okay, they wash and then they leave. And I tell them, you gargle all of that. They take something
Right,
working well. You go home, get your people tell prior itself that you guys are coming, and then you have a wash. A warm water with 70 degrees centigrade. That warmish water is good enough for putting your clothes in, and a little bit of sodium hypochlorite or a bleach, 0.1 to 0.5
right.
in that will decontaminate, and you just put all your clothes in the sun. So those are measures that anybody can do.
Right, right. Simple and easy measures which are approachable. So you
Yes, yes.
don't need to quarantine yourself unless and until you
So
you
So
you're
you
have
are
anything.
not getting leave,
not getting
Prakash.
any
Right.
leave.
Exactly. This is what I wanted to hear at the last.
You
I
you should be
think
to work with Aparna who will give you leave.
No.
no, ma'am. It's like it was really delightful to have both of you, and you have put a very. I always think about having simple and approachable measures rather than making it a lot of complications. Go to CDC guidelines. There are 200 odd pages. I don't know what to take it up. WHO keeps on telling every time first you sanitize, then you keep a mask, then you don't keep a mask. You can just sanitize. There is a lot of confusion which is happening, and we work
Prakash,
in the
you can
laboratory.
put your
Yeah.
video on. We need to see you.
No, ma'am, it's okay. That's absolutely fine. I think. Uh, It's okay. I'm here now.
Okay.
So with this, I would like to add something to all the audiences, which I had prepared as a take-home message, or which can be like in simple way of like what exactly a lab safety means. It means a lot. We might have taken some things on a very lighter note, but yes, there were a very important message at each and every discussion what we were trying to give it. There was no presentations to it, but absolutely the audiences can write to us and we can write back to you for any flow chart or any explanations which they want
Absolutely.
to it.
Yes.
So this is
Any
how I would, yeah,
one.
yes, ma'am. This is what the way I like to put upon lab safety. It may sound very simple, but it is not. There are so many things which keeps on coming into this lab safety. The important one which we were discussing was only one particular element, which was bloodborne pathogens and the training and the associated waste material and the hazard process. We can just see there is so much of it. The biosafety measures, the chemical hygiene, the fire safety. But yes, with this COVID, we are more focused and I think we are focusing and switching gears more towards the personal safety as well as the processing area safety. So this is what the arena of a lab safety means. What I would like to add is like now is the time to protect our laboratories, our colleagues, and ourselves, which is what even WHO is keeping on saying: sanitize yourself. And lab safety is for all of us. It is not only for one or two person who are just wearing PPE, going for a special procedure or a special mission or something like that. So, but yes, it is for everyone. This I have collated something which is very simple practice, which I think the questions were coming, and accordingly we have. I say it to be a sample process because it is a sampling. It is a sample process. It's a sample specimen, you can say, and it's a very simple process. It is only 7-step procedures. One is your lab hours, as you correctly mentioned when we started this rotation of the technician coming in and out, the number of people to be at one place, the number of people to be segregated, which is what we have to maintain so that there is no much of crowding happening. We are maintaining the social distancing, and we are also avoiding the risk of transmission. Like it is saying 6 feet apart from each other, it is almost a meter apart. Keeping yourself safe with a simple mask, I think, which is very important in any laboratory. I'm not saying it has to be a specialized. For a specialized process, we generally use a face shield or an N95 mask or a PPE kit. The third thing is to prioritize your hand hygiene, which has been told since a long time. Sanitize yourself first, and give the same education to everyone around you, so that your co-workers are also being safe in some or the other way. Clean and disinfect, because there are so many doors, there are so many tables which are there with drawers. Many people keep on coming at in the laboratory, so we should be having an periodic cleaning and disinfecting that area, especially our equipments, which has to be taken into consideration, which are very very important now, along with the other materials which are present. The third thing is wearing the proper PPE, whether it is actually desired to wear the entire PPE or it is a partial PPE or a minimum wearable PPE at a particular area. Define the work area and define the type of PPE what we can have. It's a very simple process which can be defined by any laboratory. I think with the guidelines, it becomes very easy to understand. You can stay home when you are sick. So, ma'am, I can take a leave when I think I am not feeling well after the work. It is a better practice. Let 48 hours be pass on, and if you are feeling well, I think you can go back to your work. That means there was nothing serious about it. But if it still continues, then as usual, do your investigations and further follow-ups. And when we are going home, practicing this distancing outside the lab also is very important. Like Dr. Jayalakshmi ma'am very well quoted, when you are going back home, clean yourself again, have a wash, and then go back. It is almost like doing a surgical procedure when you do a very good washing when you go in and then when you go out. So I think with this, we come to an end, and I share this link for lab safety guidelines. And in fact, even Dr. Jayalakshmi ma'am or Dr. Aparna ma'am, if they also share with us, we will be sharing with all our audiences. It is by WHO, CDC, and IAPM has been recently added, because I could see IAPM has put up for laboratory specially. ICMR, I don't know. I mean, the guidelines have come so stringent or not, but yes, there would be some guidelines to this. And finally, thanking you both the panel members with a very marvelous discussion and very in-depth discussion with a very lighter note and a very good message across every audience who have been joining us for this lab safety webinar. And Mahatma Gandhi has rightly told, if you want to be a change, it's like be the change that you wish to see in the world. So we have to start the change within us first, and then automatically it will go to other people.
Yeah,
And thank you so much with this. Thank you from the entire HORIBA team to both of you, Dr. Jayalakshmi ma'am, Dr. Aparna ma'am, and also Dr. Seema ma'am, who couldn't be associated with this discussion, but she had given her very valuable inputs when we were interacting before this webinar. And last but not the least, thank you to all the audiences who have joined it for this conversation, the communication, and the knowledge which we could share across you all. And with this, I would again thank you all. You can write down with the feedback to hematology.hin at the rate of horiba.com. Whatever questions, whatever guidelines you need to share, we will be doing it with you as much as we can. So with this, I take a leave, your host for the day, and my co-host, Dr. Ankur, on my backside, who is supporting on the background. Background team is always very very
very,
important.
very
But
important.
we know. So thank you to my IT team, Dr. Ankur, Mr. Shirish Dixit, and to our and to our president, Dr. Rajiv Gautam, who has given us a free hand to conduct these webinars, which are knowledge sharing sessions, which are very important, simple and approachable measures. Thank you all. Thank you so much, and take care. Stay safe. Jai Hind.
Thank you. Thank you very much. Thank you.
Thank you.
Thank you, Kaho. Thank you.
Thank you, Kaho. In fact, I just forgot to mention this word. Really very much thankful to the Kaho organization to allowing and giving us an opportunity to get associated for this kind cause and the knowledge sessions. Thank you so much.
Thanks. Thank you. Thank you.